Okay, I'm going to start out my summative checkoff for my subcutaneous medication administration by checking the accuracy and the completeness of the MAR with the physician's order. I have my MAR right here. I'm going to check for allergies. My patient is allergic to aspirin and penicillin. I'm going to check for contradictions of medication for this patient. So my patient is getting 30 units of Lantus insulin at 10 o'clock. I would check her glucose levels first. If her glucose is too low, I would not give this medication. I'm going to review assessment and lab values needed, and I'm going to wash my hands. I'm going to select the appropriate syringe and needle size. So I have my U100 insulin, 1 milliliter, 29 gauge by half right here. Okay. I'm going to gather my supplies and I'm going to check for expiration dates. So I have my insulin right here. And this Lantus insulin expires January of 2022. Right there. I'm going to check the date that the medication was opened, and I'm going to compare drug labels with the MAR 2 times before I go to the patient. So I'm giving my patient 30 units sub-Q of Lantus insulin at 10 o'clock. I'm going to calculate my dosage correctly, and I'm going to accurately prepare the medication. Okay. I'm going to start off by opening an alcohol prep pad. I'm going to wipe down the top of my insulin bottle, and I'm going to open my syringe. I'm going to put 30 units of air in there, and I'm going to pull back 30 units of insulin. I'm sorry, you can't see me. Okay. I have my 30 units. Okay. I'm going to go ahead and check one more time. So I am administering 30 units of Lantus insulin sub-Q at 10 o'clock. I'm going to go to my patient. I'm identifying my patient. I have her wristband. I'm going to ask her for her name and date of birth. I have her wristband right here. I'm going to explain the purpose of the medication. So you are receiving Lantus insulin. This is to help with your diabetes. It's going to lower your glucose levels. I'm going to assess my patient's knowledge about the medication, and I'm going to educate her as needed. I'm going to provide my patient some privacy, and I'm going to perform a pain assessment prior to selecting my injection site. So I'm going to ask her if she's having any pain today, where she's having any pain. I am planning on injecting this into her thigh. I would ask her if she's having any pain in her thigh, generally related to putting it in or injecting it into her thigh too many times, which would cause pain. I'm going to determine an appropriate angle for the medication administration based on the patient's body build and weight. This medication can be administered from 45 degrees to 90 degrees. I am going to administer it at 90 degrees. I'm going to check the medication one more time. So I am administering Lantus insulin 30 units sub-Q at 10 o'clock. I'm going to put on clean gloves. And I'm going to assist my patient to an appropriate position. This can be standing, sitting, laying down. It does not matter for insulin. I'm going to open up another alcohol prep pad. And I'm going to wipe down the thigh, the area that I'm going to inject the insulin. okay? And I am going to administer the insulin using the proper technique for subcutaneous injection. Okay, I'm gonna go at 90 degrees. All right, it's in. And I'm pushing it in quickly and quickly pulling out. She doesn't need me to hold that down for insulin. So I'm gonna dispose of the used needle or syringe into the sharps container. In real life, I would deploy the safety cap, but for practicing purposes, I'm going to recap using scoop technique. So I can reuse this needle for practice purposes. But in real life, like I said, I would deploy the safety cap, and I'm going to dispose of this into the sharps container. So there we go, into the sharps container. Okay, I'm going to evaluate the injection site and the patient's overall condition. I don't see any discoloration. I don't see any reaction to the insulin. I'm going to position the patient for safety and comfort, however my patient feels comfortable. I'm going to discard soil supplies, so I'm going to dispose of my gloves, take them off properly, dispose of those. I'm going to wash my hands. I'm going to document this on the MAR, and I'm going to come back and evaluate my patient's response to the medication in 30 minutes.